Now let's start with antiplatelet drugs. Antiplatelet drugs inhibit platelet aggregation. The drugs which inhibit platelet aggregation are aspirin, clopidogrel, ticlopidin, abciximab. Aspirin is thromboxane A2 inhibitor. Clopidogrel, ticlopidin are ADP inhibitors, and abciximab is glycoprotein 2B3A inhibitor. And these drugs are platelet aggregation inhibitors. We have plasminogen. It gets converted into plasmin by tissue plasminogen activator. Tissue plasminogen activator. This plasmin is going to cause fibrinolysis. It breaks the fibrin. We have a one class of drug known as thrombolytic drugs or tissue plasminogen activators or fibrinolytic drugs. They include streptokinase, urokinase. These drugs can be used in myocardial infarction. Anticoagulants, which are also known as antifibrin drugs, they are another class of drugs. They include warfarin, heparin. Remember, we have some clotting factors like 2, 7, 9, 10. These clotting factors are inactive. They are activated by vitamin K. As you can see here, by the help of vitamin K, they becomes active. 2A, 7, 9, 10. See guys, we have a drug known as warfarin or dicumarol. They inhibit vitamin K and inhibit the activation of these clotting factors. That is the anticoagulant effect. Once warfarin or dicumarol inhibits the vitamin K, they prevent the activation of these clotting factors. Here you see that this is dicumarol. We have a antidote known as dimercaprol. Dimercaprol is also known as British anti-Lewisite. British anti-Lewisite, and this is antidote for ball, bismuth poisoning, arsenic poisoning, and lead poisoning. Remember this heparin is given in the first trimester of pregnancy. Heparin is given in the first trimester of pregnancy. Remember, vitamin K results in gamma carboxylation of glutamate residues of 2, 7, 9, 10 clotting factors. The result, gamma carboxylation of glutamate residues of 2, 7, 9, 10. Therefore, result the activation of these clotting factors. Remember, warfarin is contraindicated in first trimester of pregnancy because they can lead to fetal warfarin syndrome. We have one question that if a female taking warfarin becomes pregnant, then change warfarin to heparin. We have to change warfarin to heparin because warfarin can lead to fetal warfarin syndrome. We have some drugs like erythropoietin or darbepoetin. They are used in anemia due to chronic kidney disease, anemia due to bone marrow suppression. This bone marrow suppression can be due to anti-cancer drugs. Therefore, if there is anemia due to anti-cancer drugs, we can use erythropoietin or darbepoetin. We have a factor known as granulocyte colony stimulating factor. Granulocyte colony stimulating factor, like its analogs are filgrastim, pegfilgrastim. These drugs are used in leukopenia due to anti-cancer drugs. Leukopenia means decreased blood WBC's count. Decreased WBC count due to anti-cancer drugs, we can use filgrastim. We have interleukin 11. Its analog is operalvikin. This operalvikin is used in thrombocytopenia due to anti-cancer drugs. It is used in thrombocytopenia due to anti-cancer drugs. Thrombocytopenia means decreased platelet count. Now, we have anti-diarrheal drugs. The drug of choice for diarrhea is ORS. WHO reduced osmolarity ORS is very important for your exam. Its contents you have to remember. Sodium is 75, glucose is also 75. Sometimes they can give you glucose is 90, but that is wrong. Chloride is 65, potassium is 20, citrate is 10. You can see at the end of citrate there is Te. If you add 10 it becomes, if you add N it becomes 10. So the total osmolarity is 245 millimoles per liter. Now we have infective diarrhea. Infective diarrhea can be amoebic diarrhea or bacterial diarrhea. Amoebic diarrhea or bacterial diarrhea. The drug used in the amoebic diarrhea is metronidazole, and the drug used in bacterial diarrhea is ciprofloxacin. Another type of diarrhea we have that is known as non-infective diarrhea. In non-infective diarrhea, we use anti-motility drugs. This non-infective diarrhea can be due to chemotherapy. That is, chemotherapy induced diarrhea is actually a non-infective diarrhea. In non-infective diarrhea, we use anti-motility drugs like loperamide or difenoxylate. This was the exam question which you can remember. Now, the drugs used for secretory diarrhea. Secretory diarrhea is seen in carcinoid syndrome or VIPoma. In carcinoid syndrome, what is going to increase? 5-hydroxytryptamine. 5-hydroxytryptamine is also known as serotonin. 5-hydroxytryptamine is also known as serotonin. In VIPoma, vasoactive intestinal polypeptide is going to increase. In secretory diarrhea, we use octreotide. This octreotide is somatostatin analog. What the octreotide is going to do? It inhibits secretion of 5-hydroxytryptamine and vasoactive intestinal polypeptide. Okay. Now, macrolides. Macrolides is a group of antibiotics which include azithromycin, and it is drug of choice for CLAP. It's a mnemonic. C for chancroid, L for legionella. Legionella causes Legionnaire's disease, and this was the exam question. A for atypical pneumonia, and P for pertussis. Pertussis is also known as whooping cough. Now, another important topic, radiosensitizers. What are radiosensitizers? They are drugs actually which making our cells more sensitive to radiotherapy. They are making our cells more sensitive to radiotherapy, therefore can increase toxicity of radiotherapy. They can increase the toxicity of radiotherapy. Their drugs include A, B, C, D, E, F, G. R-trans-retinoic acid. R-trans-retinoic acid is actually a vitamin A. Then bleomycin, cisplatin, doxorubicin, epirubicin, 5-fluorouracil, gemcitabine. Also we use metronidazole. Okay. Remember that doxorubicin and epirubicin, they are cardiotoxic. Also remember that doxorubicin and epirubicin belong to an anti-cancer drug class which is known as anthracyclines. They belong to anthracyclines group of anti-cancer drugs. Very important. How you can remember that they are cardiotoxic? Remember Ruby. In the name of doxorubicin, The name is given ruby, means ruby dil le gayi. Doxorubicin, epirubicin. Okay, if you see this type of question, you will be given a history that a patient is having head and neck cancer, and what type of which radio sensitizer you can use. There will be lot of options, and this was the option in your exam, cisplatin. In head and neck cancer, we can use cisplatin and 5-fluorouracil. I hope this is clear. Now let's see another important topic, that is therapeutic index. Therapeutic index equals to LD50 by ED50. It equals to LD50 by ED50. LD50 means median lethal dose. ED50 means median effective dose. How to remember this? Remember a mnemonic tile. TI means therapeutic index, L for LD50, E for ED50. Okay. Now, what does it mean LD50? It is the dose at which 50% of animals die. It is the dose at which 50% animals or humans die, mostly animals. Okay. ED50, it is the dose at which 50% patients will get desired response. It is the dose at which 50% patients will get desired response. Now, this therapeutic index tells the safety of a drug. It tells about safety of a drug. Okay, you will be given efficacy of a drug, potency of a drug, but remember it tells about the safety of a drug. If there is increased therapeutic index of a drug, that means the drug is safe. Example, penicillins, they are safe. If the therapeutic index of a drug is decreased or low, the drug is unsafe. Drug is unsafe. Now, if any drug who is having low therapeutic index should undergo therapeutic drug monitoring, TDM, therapeutic drug monitoring, because this drug is not safe. That's why therapeutic drug monitoring is done. So you have to remember, therapeutic drug monitoring is done for drugs having low therapeutic index. Now, what kind of drugs you need to do TDM? Remember a mnemonic, a drug possessing low therapeutic index. It is itself a mnemonic. A for antibiotics like aminoglycosides, which includes gentamicin. D for digoxin, P phenytoin, and most of the anti-epileptics like valproate, they should also undergo TDM. L for lithium. Phenytoin was asked in the exam. T for tricyclic antidepressants. I for immunosuppressant drugs like cyclosporin, tacrolimus. Now we have a one question, that all of the following are side effects of ritodrine except. All of the following are side effects of ritodrine except. The options are hypoglycemia, tachycardia, hypotension, pulmonary edema. Let's see, this pulmonary edema is a specific side effect of ritodrine. It is a specific side effect of ritodrine. Therefore, it cannot be the answer. Okay. See, this ritodrine is beta 2 agonist. It is beta 2 agonist. Okay. It causes vasodilation. It's a vasodilator. Therefore, it can lead to hypotension. That means hypotension cannot be the answer. Also remember, if ritodrine is used in overdose, it can stimulate beta 1 receptor, therefore can lead to tachycardia. Therefore this cannot be the answer. This retardin results hyperglycemia. It cannot lead to hypoglycemia. Therefore the hypoglycemia will be the answer of this question. Instead of retardin, they can give you another beta agonist, that is salbutamol. So remember this one also. Salbutamol is also a beta 2 agonist. Now remember labetalol. This labetalol is a beta blocker. It is not only beta blocker, it is alpha as well as beta blocker. How to remember? La. A is like an alpha. Beta, it is alpha and beta blocker. Also remember, it causes bradycardia as a side effect. It causes bradycardia as a side effect, and it is drug of choice for pregnancy induced hypertension. Pregnancy induced hypertension, that is gestational hypertension. Okay, I hope this is clear. Now remember, beta blockers are contraindicated in A, B, C, D. A for asthma, B for block like AV block, atrioventricular block, C for congestive heart failure, that is acute congestive heart failure. In chronic congestive heart failure, we can use beta blockers. And D for diabetes mellitus. Why we don't use beta blockers in the diabetes mellitus? Because they can lead to hypoglycemic unawareness. Okay. Now, commonly used beta blocker in glaucoma is temolol. Commonly used beta blocker in the glaucoma is temolol. Sometimes they can give you a clinical scenario that a patient of glaucoma is given temolol, but is given a drug, and the asthma of a person worsens. What kind of drug you have given? In question they can give you timolol as an option, and therefore you can choose that option. I hope this is clear. In FMG Jan, this was a question asked in the exam. Vasomotor reversal of Dale. What does it mean, vasomotor reversal of Dale? See, we have to give first alpha blocker to the patient. Alpha blocker means, and alpha blocker include like phentolamine. If we give phentolamine alpha blocker to a patient, then we have to give high dose of adrenaline. Then we will observe fall in blood pressure, that is severe hypotension. If we are giving alpha blocker like phentolamine, then we are giving high dose of adrenaline, you will see severe hypotension in the patient. That is known as vasomotor reversal of Dale. I hope this is clear. Now see another important drug, that is chloroquine or hydroxychloroquine. Regular monitoring of visual acuity and fundus examination is required for this drug, because these drugs can lead to bullseye maculopathy. They can lead to bullseye maculopathy. What does it mean, bullseye maculopathy? It means the macula shows central area of hyperpigmentation. As you can see here, this is the macula here. This area, central area, is hyperpigmented. This is total black area, is hyperpigmented, surrounded by zone of hypopigmentation. This white zone you can appreciate here. This is the hypopigmentation zone, and this one is the hyperpigmentation zone. This is called as bullseye maculopathy. Now let's see